Hello, I'm Melanie Cohn, and this is my vlog for my website, able2relate.info. Check it out when you're done watching this video, and it has some articles on there and other things that you might find interesting. This vlog today is going to be about how to treat depression. I do get a lot of people coming to me wanting to decrease depressive symptoms, wanting to return to previous functioning, be happier. I mean, that's the general, is just to be happy. So I just wanted to talk to you about a couple of depression treatment options for you. So the general ones, and the ones that you probably know most about, are antidepressants and psychotherapy. Antidepressants, that's medication formulated to treat depression and depressive symptoms like crying spells, increased frustration, not wanting to get out of bed in the morning, those kind of symptoms that cause you to come to seek a professional in the first place. I'm not going to go into the actual medications because medications like that need to be prescribed by a medical doctor. So you would either go to your primary care physician if they feel comfortable prescribing you something, or you can go to a psychiatrist. They are medically trained, and they're the only ones that can pull out the prescription pad and write you a prescription for a medication based on your symptoms. The other type of treatment that people come to me for is psychotherapy or talk therapy. And in talk therapy, you're going to be figuring out what the depression symptoms are, what your triggers are, what precipitated the depression, whether it's going back to childhood from 20 years ago or a situational type of depression. Maybe you're getting divorced, or you've had a traumatic event, or somebody close to you has died. That can all trigger depression and depressive-like symptoms. When you're coming for talk therapy, there are many kind of treatment modalities within talk therapy. Here are a few of them. There's cognitive behavioral, there's dialectic, there's psychodynamic, psychoanalytic, humanistic, hypnotherapy. I mean, there's just many different modalities out there. But when you're going to see somebody and talk to them, you basically want them to have an eclectic approach. You want them to be able to be where you are and with what you need, and not so narrowly focused that they're just gonna do one particular thing, because it might not work for you. So you want to be with and seek a therapist that is functional and can move with you. So another type of depression treatment that a lot of people don't know about, it's pretty rare, they don't do it very often, is called electroconvulsive treatment, or electroconvulsive therapy. It's also called shock treatment. You may have heard of that, and that's often used when all other methods have failed, when it's a severe depression, and that is done by a physician. You go 2 to 3 times a week, and they actually put like electrodes on your head and do these shock treatments that are supposed to work with the temporal and frontal lobes of your brain, helping you to release some of those symptoms. But again, that's a pretty serious treatment, and it's used when all other types of treatment have failed. And even so, even when doing that, they tend to use antidepressants along with that. It has about a 50-50 success rate, so it's not even the best. In looking at the research, what I found is a combination approach works the best with antidepressants, and psychotherapy or talk therapy seem to work the best for people. So those are the types of treatments that are out there. Hope this helps, and wishing you healthy lives and happy lives, and I will talk to you soon.